Hello and welcome to Mini Medicos. Today we will discuss about diabetes mellitus, its types, symptoms, diagnosis and treatment. Diabetes mellitus is a metabolic disorder associated with hyperglycemia and defective insulin secretion or its action. Types of diabetes mellitus are type 1 diabetes mellitus, type 2 diabetes mellitus and maturity onset diabetes in youngs. Type 1 diabetes mellitus. In this type of diabetes mellitus, beta cells of pancreas are damaged that cause decrease in the production of insulin and C-peptide. If more than 80% of beta cell mass is damaged, symptoms of diabetes mellitus appears in the patient. C-peptide and insulin are secreted by beta cell of pancreas in 1:1. Causes of type 1 diabetes mellitus. Most common causes autoimmunity. It involves two types of genes. First one is HLA genes like HLA-DQ2 and DQ3. Second one is non-HLA genes like CTLA4 and PTPN22. Viral causes. In viral causes, Coxsackie virus is most common. Other are mumps and rubella. Bronze diabetes mellitus is due to iron toxicity. Symptoms are polyphagia, polydipsia, polyuria and weight loss. Diagnosis of diabetes mellitus. Random blood sugar more than equal to 200 mg/cent. Fasting blood sugar more than 126 mg/cent and 2-hour glucose tolerance test. In this test, we give 75 mg of oral glucose to the patient and measure blood glucose level after 2 hours. If it is more than 200 mg/cent, then test is positive. HbA1c is glycosylated hemoglobin. It gives glucose values over few months. Treatment. Main treatment of type 1 diabetes mellitus is insulin. Most common route of giving insulin is subcutaneous route. Insulin is also given via intravenous route in case of emergency conditions like diabetic ketoacidosis or hyperosmolar coma. Sites of insulin injection are given in this image. First one is anterior abdominal wall 2 cm away from the umbilicus, upper outer arm, anterolateral aspect of thigh, buttock region. Type 2 diabetes mellitus accounts for about 90 to 95% of total cases. It is mostly present in adults and overweight individuals. It is a complex multifactorial disorder and involves the development of insulin resistance. Sedentary lifestyle, obesity, and dietary habits are also contributory factors. Treatment. In this video, we will do only an overview of the treatment, while detail about the treatment will be discussed in another video. Diet control. It is the first step and carbohydrate is strictly regulated. Exercise. It increase GLUT4 levels and this GLUT4 will promote sugar entry into muscles resulting in decreased blood sugar level. Exercise of about 30 minutes per day for 5 days per week is recommended. Bigonides, they inhibit hepatic gluconeogenesis. Drugs in this group are metformin and fenformin. Drug of choice for treatment in obese diabetic patient is metformin. Fenformin is not used nowadays because of its side effects. Next group is sulfonylureas. Drugs belonging to this class are chlorpropamide, tolbutamide, glipizide, glycoside and glyvanelamide. Thiazolidinediones. This class include pioglitazone and rosiglitazone. Side effect of pioglitazone is bladder cancer and side effect of rosiglitazone is congestive heart failure. Next class is alpha glucosidase inhibitors. This class include ascarbose and volgibose. They act by inhibiting glucose absorption from GIT. and their side effect is osmotic diarrhea. Meglitinides include rapaglinide and natiglinide. They increase insulin secretion. Side effect is hypoglycemia. DIPEPTIDYL peptidase 4 inhibitors include sitagliptin, saxagliptin, and vildagliptin. Most common side effect of these drugs is nasopharyngitis and upper respiratory tract infections. Glucagon-like peptide 1 agonists include zenaglutide, liraglutide, and dulaglutide. Most common adverse effect is nausea followed by vomiting. Sodium glucose cotransporter 2 inhibitors include they cause urinary loss of glucose, resulting in decrease in blood sugar level. Canagliflozin, dapagliflozin, and artugliflozin are the drugs belonging to this class. Most common adverse effect of this class of drugs is urinary tract infection because they cause glucose loss in urine. Pathology and pharmacology of oral hypoglycemic drug will be discussed in another video. Thanks for watching. Please like and subscribe Mini Medicos.